Today, I'm diving into the essentials of navigating healthcare abroad, what retirees need to know before making the move, and how I've set up my own system to ensure that my healthcare needs are met while I'm living and traveling abroad. I'm Shawn, Queen of DC, full-time solo traveler. On this channel, I post my travel tips and adventures from around the world. If that's your vibe, subscribe. If you're in the U.S., you know healthcare can keep us tied to our jobs longer than we would like. A single accident can lead to financial ruin. Many feel trapped and unaware that high-quality, affordable healthcare options exist outside the USA. Let's break down the alternatives and how you can take control of your healthcare while living abroad. As a woman, healthcare was a major concern, but I wasn't going to let it stop me from moving. Before quitting my job, I made sure all my medical appointments, tests, and dental care were up to date. If anything felt off, I was at the doctor with my copay, like, check it out, do whatever you got to do, run the test. I was on it. People were like, you're a hypochondriac. Mind your business. You don't have nothing to do with this. Okay, this grown folk business. Stay over there. You don't have nothing to do with this. I also informed my doctors of my travel plans so they understood why I wouldn't be coming in, and if I ever needed to contact them from abroad, they would be willing to help me. And they were all very happy about my plans and told me if I needed anything, just to call them. Here are 3 things you need to do. Number 1, plan by researching your route, identifying places to consult doctors, and secure your medication. Verify if your medication is accessible in the countries you plan to visit. For example, I use a medication that is not available in Vietnam, but it's available in Malaysia and Thailand. I live in these bordering countries, so I can just travel to Malaysia and I could just travel to Thailand for medication. And some medication costs less in different countries. For example, there's a medication that costs less in Thailand than in Malaysia. So maybe I'll just hop over to Thailand and get a refill on my medication if I'm going there anyway, if it's worth it, or I'll just get it in Malaysia. But knowing that it's not available in Vietnam, I still have options. Why did I say options like that? I don't know how that came out. I just felt it. I was like, wait a minute. Options. Anyway, moving on. Number 2, explore countries with reliable and cost-effective medical tourism. I have a video playlist linked above on medical tourism in Malaysia, Bali, and Vietnam. My medical visits are done in Kuala Lumpur, Malaysia. I have an entire video on my full day of a comprehensive health exam at their top-tier medical center, and the price, unbelievable. And I've recommended to several friends who have gotten their care done there as well. There is no way that I can talk to a renowned specialist in the United States for $38. Total visit, $38. It's not happening. In Vietnam, I get my teeth cleaned for $8. I've never in my life got my teeth cleaned for $8. First got them cleaned, they were $6 because they had a promotion going on for new patients. Come on now. And they do an excellent job. In Bali, I got my teeth cleaned, and where else? I had an emergency clinic visit in Malaysia. It cost me $25, including medication. Locals were telling me, you paid too much. I'm like, what? I did? I've never had that experience in the States without insurance. Number 3, stock up on your medication before you leave and ask your doctor for a written prescription. My insurance company had a vacation override travel supply policy that allowed me to refill my prescription up to a 90-day supply. I left the country with a 6-month supply. Based on my experience, having your prescription bottle may allow pharmacists to refill the prescription without a new prescription. Even without the bottle, I've been able to buy my medication in Malaysia, Thailand, and Vietnam if they have the medication. In Mexico too, I had to go to the emergency doctor, the Farmacia, Playa del Carmen, and I got sun poison really bad. And what that is my entire back blistered. It was Oh my God, it was so painful. It was disgusting. I had blisters all over my back. It was in heat. It was in heat. It was heated. It was hot. It was very painful. So I had to go to the doctor. He looked at me. I paid about $20. I have a video on it in my medical tourism video. Yeah, you just never know. Accidents happen. And that's why you never travel without travel insurance. I use Safety Wing Travel Insurance. I pay monthly. It's tiered based on age. Even though I can pay out of pocket because it's affordable, I have that coverage for cases of emergencies, for evacuation, and repatriation if something goes wrong, something goes fatal. I have to have that travel insurance as backup, even though I can pay out of pocket for my routine medical care because it's affordable, but you never know. You never know. Never travel without travel insurance. And there are a variety of policies that you can look into, research. There's Cigna Global, there's Geo Medical, I think. If you go to a Square Mouth and it lists all the various travel insurance and look for international travel insurance. If you're going to do this, do not travel without travel insurance. Minimize your stress during times of emergencies. I've included my Safety Wing referral link in the description box below. This is the strategy I've used to travel globally for 2 years, attending doctor visits and obtaining necessary medication. Knowing that I would have access to reliable and cost-effective health care gave me peace of mind as I made my move. I know some of you fight being on social media, but if you're traveling, moving abroad, I highly recommend you join Facebook, expat, and travel groups to connect with locals and fellow travelers. These groups are invaluable for finding medical recommendations, learning about healthcare systems, and knowing which places to avoid. These groups are a great resource for navigating life abroad. I'm fortunate because I'm healthy, but unexpected things happen. I've put these systems in place to help alleviate stress during time of emergency. I'm in a position where I live in places where the healthcare is affordable, I can pay out of pocket, and I have access to quality care. I'm often asked, is there a language barrier when receiving healthcare abroad? In Malaysia, English is widely spoken in the healthcare system, so I've never had any issues. In Bali and Mexico, I also didn't experience any language barriers with my healthcare providers. However, in Vietnam, there's more of a language barrier. While I can manage dental care, I'm not as confident about medical care, but I've heard great things about their system. Healthcare is a priority, and I want you to know, even if you have pre-existing conditions, you can still access high-quality, affordable care abroad. It just takes research. Don't let healthcare fears hold you back from moving if that's what you want. I met a man from the United States whose mother comes to Kuala Lumpur for cancer treatments. After doctors in the U.S. gave her 6 months to live, he found an alternative facility in Malaysia. She's surpassed that prognosis, proving that sometimes the best care is not always at home. People are waking up and realizing there are better systems and options beyond what we have been conditioned to accept in America. I hear this often, I want to leave now but healthcare. If you don't leave now, when will you? Will it be when your body is worn down and you can't fully enjoy life? I realized that if I had kept working, it was just to accumulate more stuff. Sitting in my cozy home, surrounded by things, but at what cost? My health. Healthcare, finances, the fear of the unknown keeps you tied to a system that no longer serves you. At some point, enough is enough. The opportunity to live well on your terms is out there. You just have to take the leap. Check out my medical tourism video for more insights. Until next time, peace.